Hi, I'm Karen Price, Co-Director of Family Support Education with Vermont Family Network. I'm joined today by Marilyn Mahusky, Staff Attorney, Disability Law Project, Vermont Legal Aid. Our organizations have been hearing from families who have children with disabilities about various concerns regarding going back to school this fall. Families have many opinions and experiences with remote learning as well. Our goal for today is to provide helpful information to families as they review their school options and make the decisions that work best for their child and family. Vermont Family Network is one of nearly 100 parent centers in the United States. Parent centers help families who have children aged birth to 26 with disability or special health care needs. At the Vermont Family Network, we help families with educational, health, and other disability-related needs. Like most parent centers, our staff are parents of children with disabilities or special health care needs. We use a peer model of support, parents helping parents. We are a statewide nonprofit organization. Our services to families are free and confidential. No referral is needed. There are no eligibility requirements to receive our services. Our website, which includes contact information, is vermontfamilynetwork.org.
Good morning. The Disability Law Project is a special project within Vermont Legal Aid. We have offices around the state. We serve a variety of people who have legal concerns, including housing, discrimination. The Disability Law Project represents specifically people with disabilities who have legal issues arising out of their disabilities. The Disability Law Project is not income-based, so the criterion is that the individual who's seeking the legal assistance or the person you're seeking legal assistance on behalf of, for example, your child is an individual with a disability. 30% of the work of the Disability Law Project is in special education. There's a significant need for advice and information. We work closely with Vermont Family Network. On a very limited basis, the Disability Law Project is able to represent parents and students at IEP meetings. We participate, represent in mediation and filing for due process. We also can assist with filing complaints with the Office of Civil Rights based on disability discrimination or violations of your student's right to a free and appropriate public education.
So the latest guidance from the Vermont Agency of Education, a strong and healthy start, hybrid learning during the 2020-2021 school year, dated July 15th, 2020, states that reopening school in the fall should focus on the return to in-person instruction. However, each school district must plan for a certain amount of flexibility to shift school instruction along a continuum of options, from full in-person instruction to full remote learning, including a hybrid learning approach that might include both. By this time, you might have received information from your school district about the plans for your child's school. We will cover some basics of attendance and truancy, homeschooling, special education, and instruction for homebound and hospitalized students. So Title 16, the General Education Statute, defines attendance. Children between the ages of 6 and 16 years must attend a public school, an approved or recognized independent school, an approved education program, or home study program, unless the child is mentally or physically unable to attend, or has completed the 10th grade, or is excused by the superintendent or school board.
So truancy, let me expand on that a little bit from what Karen was saying. So under Title 16, as Karen referred, which is the education statute in Vermont, attendance is mandatory unless your child's attendance is excused. Excused usually occurs when there has been approval by the, your child is sick or you have some other approval for missing school. The statute requires that your child attend for the full number of days for which school is held. That's the language from the statute. That means that 1 day of absence, of an unexcused absence, technically means that your child is truant. We haven't seen consequences necessarily very often for 1 or 2 days of missed absences, but it doesn't mean that the truant officer couldn't contact a parent if a student is missing school. The consequences for missing school are that the school district would be required to notify you. They could make a referral to a truant officer, and that's someone designated within the school district. It could also be law enforcement. They would make a referral to the Department for Children and Families. Certainly there are many referrals to the Family Division of the Superior Courts in which parents are cited for failure to ensure that their children are in school. The last stats that we'd seen is for 2013 is that there were 134 truancy cases filed in courts around the state. The statistics statewide are about 7.9% of children are truant on average in a school year. Schools do have an obligation to ensure that students are in school, and the charges that would be filed by the truant officer or the school district or the referral to DCF would be a filing in the family division in the juvenile courts. We have seen some cases where DCF has filed for parents who have not pursued proper homeschool programs for students. During COVID, as the earlier slide indicated, there were a lot of kids who were missing school, and we did not see an increase in truancy, or we're not aware of there being an increase in truancy. So I think the question remains, as schools reopen, what the consequences would be. But we do want to make parents aware of the fact that there are legal consequences for a failure to ensure that your child is actually participating in some sort of educational program.
So homeschooling is the education of children inside the school. This education is usually done by parents and sometimes by tutors. In order to homeschool in Vermont, families must submit home study enrollment paperwork to the Agency of Education Home Study Office. Rolling enrollments are accepted as long as the student is enrolled elsewhere, public school or private school, until the receipt of an official home study enrollment complete letter. Students with disabilities enrolled in home study programs are not entitled to special education services at the public schools. Public schools may choose to provide special education to homeschoolers through a services plan, but this is not an entitlement. A services plan may include instruction, consultation, special education, and/or related services. Families who would like to be considered for a services plan for their child should contact their school district special education administrator. There is no special funding available for homeschoolers. Parents can withdraw from home study at any time. All that has to happen is that the parents will have to send the Agency of Education Home Study Office an email with the date of the withdrawal and the school that the student will be attending. So the definition of homeschooling is that at least 3 of 5 of the core classes are delivered at home. And the child will still be considered a home study student. So families can do that hybrid approach. Core classes are considered classes in math, reading and writing, math, history, government, civics, natural science, and literature. Non-core classes would be considered to be PE, physical education, health, and fine arts. If a student with a disability is participating in a class at the public school and needs supports and/or services to access the class, then the student may have a services plan or IEP for that class. For example, if the student has a math disability and needs specialized math instruction in order to access an algebra class, then the student may be able to receive services plan or special education services for math only. If the student has a reading disability and wants to access a PE class, then the student most likely will not need any reading supports and services. All of the guidance and forms are available on the Vermont Agency of Education website. And keep in mind, it does take about 2 weeks for forms to be approved.
So we wanted to talk a little bit about IE placement in this context. Likely, if you're listening to this, your child has a disability. Your child may or may not have an IEP already. Part of a decision for what kind of services your child is going to receive is after you have established the IEP team has written the IEP goals and objectives, then a decision must be made about placement. Placement is not a place, technically. It refers to the provision of special education and related services. The Vermont regulations actually prohibit the thinking of placement as an actual location, although I think there is some room in the federal regulations to argue that that's probably an incorrect interpretation of the federal law. But what's important to think about is that when the IEP team, which of course includes the parents, is considering the child's placement, the placement decision needs to be based on what the child's individual needs are. And that's really important. Decisions cannot be based on fitting a child into a program. It cannot be based on what your child's disability is and assuming that because your child has a specific disability, they would need to be placed into this program. So it's really important to be thinking about what are the individual needs of your child and where is the best what is the best means for providing your child with special education and related services. Some important considerations in making that decision are what is the least restrictive environment? What the law requires is that children are educated with their abled chronological peers. The preference is for education in your home school. So often we think about that as the school where your children would go. Or where their siblings may go, whether they have a disability or not. And that the provision of special education is, and least restrictive, is also consideration of what supplementary aids and services your child might need in order to be successful in that placement. School districts are required to provide a continuum of alternative placements. So we think of the least restrictive environment as being in your homes, the school in your home community, but that could be a significant range of placements, including instruction out of the classroom. It could be instruction within the classroom. It could also be home instruction, and also in hospitals and residential facilities. So those are all the factors that must be considered in making a decision about where your child's IEP services will be provided.
One additional part of the regulation that we would like parents to be aware of is concerning homebound and hospitalized students. So children are eligible for instruction at home or in the hospital whenever they are unable to attend school for a period of 10 consecutive school days or more because of pregnancy or other medical disability. So children who are eligible for early childhood special education services will receive direct instruction as determined by the child's IEP team, of which the parent is a member. For elementary age special education students, they will receive IEP services for no less than 6 hours per week, unless inconsistent with medical recommendations. For homebound or hospitalized secondary aged special education students, they will receive IEP services for no less than an average of 2 hours per subject per week, unless, again, inconsistent with medical recommendations. In order to access these provisions, the family does have to provide medical documentation.
So some things that we think are important for families to be thinking about as school resumes. As Karen mentioned earlier, the Agency of Education has issued guidance. They are encouraging school districts to return to in-person instruction. We know that there will need to be a continuum of supports from full in-person instruction to possibly full online instruction or remote learning. So for children who have IEPs, children who are on IEPs, we think our recommendation is that prior to the start of the school year, parents should request that an IEP team meeting be scheduled with the school. There are a number of reasons for this. One is to review your child's progress prior to COVID, during the period of the pandemic when your child in the spring was receiving remote learning, to review any progress during summer services if the child was offered any sort of summer services. It's important to look at the data that exists. That's why we say go back and look at how your child was performing prior to COVID, during the period of remote learning, and then what, if any, regression the child might have experienced during the summer, whether they were receiving services or not. So it's important to be thinking about compensatory services if your child did not make progress during this period, or if the school district was required to provide services to your child that were written into the child's IEP. This is a time to be thinking about how those services are going to be made up, how they're going to be recouped. On the Vermont Family Network website, there are some draft letters that you can use in terms of thinking about compensatory services. So you can go to their website and get some assistance in drafting those letters. Another factor you should be thinking about is if has the school district provided your child with the services they need during remote learning? And if we were to return to remote learning, or if there were a hybrid approach within your district, does your child have the services, including assistive technology and adaptive equipment, that they need in order to be successful during the period of remote learning? When Congress passed I believe it was the 4th CARES Act, there was significant funding available to the local school districts through the State Agency of Education, specifically for connectivity, assistive technology for children with disabilities, and for adaptive equipment. It's important too for families to be thinking about, is it safe for your child to return? And certainly I would imagine that with the goal of all students returning, schools are going to need to be thinking about children who may have unique needs that make it challenging for them to return. And as a preliminary matter, it would be important to have a conversation with your child's physician, make sure that the physician is on board with that decision of keeping your child at home. There may be children who have who are immunocompromised that may affect that child and other siblings if the other children are in the school. So those are important conversations to have with your physician prior to the start of school. Very likely you're going to need more than just a physician's note, so it is going to be important that you have an IEP team meeting to discuss that concern about your child returning to school. Certainly, you can be thinking about homeschooling and going through that process, as Karen described earlier. You can also think about, and the IEP team would need to consider, whether placement of your child is appropriate at home. So for a child who maybe, for whom going to school could be detrimental to their health, then you could think about actually having the IEP team make the decision that placement at home is appropriate. The benefit of doing that is, compared to homeschooling, of course, is that the IEP team, the IEP services would be required to be provided. So it's really important as families think about return to school that they're thinking about the various options and the various consequences. As Karen indicated, homeschooling can be a hybrid in and of itself. So you might provide some services to your child at home through a homeschooling program and send your child to school for other services. Currently, that's happening prior to COVID. We imagine it will be happening during COVID. But it's important that you have a conversation with your school district and have the IEP team make a decision that best meets your child's needs.
So contact us at the Vermont Family Network through email or phone. Our website has many resources, including, as Marilyn mentioned, our latest edition has sample letters regarding compensatory services requests. We also have information on social media, on our Facebook page, and we also put out e-newsletters about once a month.
And you can also feel free to contact the Disability Law Project. Here is our contact information. As part of Vermont Legal Aid, our intake is through a hotline. You can call the hotline and indicate you have a concern about an educational issue. You can also go online and access the intake through our website, and also there is information on our website about education that we're trying to keep updated as well.